So, client is in pain. So I'm gonna let her explain real quick.
So it's basically at the base of my scapula, towards my spine, and if I lay on my arm, it goes numb, and it is a constant dull ache, like throughout the day.
Okay. So my idea, what I'm thinking, because it's kind of tight right in here, so that's definitely compensating. So the way I like to work is, let's get a different angle. Okay, we're gonna figure out what's making this compensate, and it's gonna be coming from the extremities. So I'm following the tight fascial line. Usually when it's in the shoulder area on the back, it's gonna be more from the outside where the pinky is up into this area. But if it's more tight here and gonna cause a spasm into the neck area, it's gonna be coming from the thumb here. So when I follow the tension line from here, because the rotator cuff right down here is holding really hard, and that's why the seratus posterior inferior is getting challenged and has a dull ache. So to relieve that, we work, because that's tight right there, and into this area that is also tight. So what I'm looking at, when I get into the hand area, I'm palpating the wrist, and the outside where the pinky is, it's protruding more right there. So that's indicating that I was correct, because the outside is pulling harder. So if I palpate along the outside up into the pinky, hold the joint there, I can figure out if it's more on the outside or the inside of the pinky. So it definitely feels tighter outside there. So I get into the tip of the pinky. You can even see it. I don't know if you can see where the red is, and then where the white right there, where there's a lack of blood flow. But there's a little spot right there that I push on. I push into the pinky and down towards the joint, because I want to essentially disengage that nerve all the way up to the shoulder. And that'll address the nerves first so that the muscles can relax. Sometimes the joints are a little out of alignment, but once I get that nerve relaxed, if they want to go where they should, they will. And it's not too tight in here, actually, at the base of the pinky. So it's more right in here, which makes sense because this is the shoulder in reflexology, and her tension is inferior to the scapula. So if that's the scapula right there, this is just inferior to it. So my assumption is there is a level of scar tissue buildup from some sort of injury by straining it. Now, should I tell everybody what you do for a living?
Sure.
She's a massage therapist. So I am not surprised that there is a tight spot right here in her hand. So once I get this released, which it'll release a lot faster after I disengage the nerve in the pinky. It's softening up pretty fast. All right. So below that isn't bad, but this is where, take a deep breath.
Definitely tender.
Yeah. We're trying to stretch it and pull it away from the pinky down towards the wrist. So we want to bring everything this direction. Oh, that joint just went where it should. Okay, so I got that loosened up pretty good. So looking at the wrist, it's still protruding there, but if I push on it just right, straighten the pinky. Yep, we got, oh, a little adjustment there. Joint manipulation, that's in my scope. And if I wanted to target this finger, this one's actually in really good shape. But if this one was tight, I would grab it like this and keep it straight, and then grab at the wrist and do more twisties. And that one did move also. So we might as well just check the rest. You have lots and lots of bones in there. That one moved too. It's always good to check all of them. Nope. Oh, yep, that one moved. And then the last one, the thumb. I don't know if you heard that.
I don't know if you could not hear that.
Alright, so now we're looking at the wrist. And the wrist is feeling amazing. It's a lot softer right here where that protrusion, that bony protrusion was, because I released everything that was pulling on it. So if, that's tight too. So if I follow, the idea is, since I got this released and I got this released, the shoulder should be relaxed. So if I go back into this area and I palpate right in here, it does not feel like it's compensating anymore. We've got a nice squish in there. Does that feel different?
It's definitely less tight.
I win! So after I get this released, essentially I would go in and I would have her flip over, and I'll do another video on it next time, but I would essentially go in and shorten and relieve tension where the posterior inferior seratus is, and then find knots on that and melt those out. But we're just gonna look at the front today and get that released. And then we've got the shoulder here, so that when was it when you lay on it?
Yeah.
It falls asleep?
Mm-hmm.
Okay. So right now, since this was so tight and compensating, it's gonna cause this area to tighten up as well to help compensate. So sometimes I can get out of alignment, and if I find the tightest spot, that feels like a twangy guitar string.
Mm-hmm.
Because it's being challenged. So what I do is I find the spot, I shorten it so it knows not to fight anymore. Release the tension in the joint by putting pressure into it. And then I'll disengage the muscle there. And there's some right here. Ooh, yeah, that's tight. Okay, this one, we got this way. I felt a pop in there. Okay. That one let go. I think there's one more spot. Yep. Right here. And she has to stay relaxed for this, or it doesn't work. Okay. So weird with no music. Okay, I think I got that all to let go. And then we'll use the palm. See if we get anything else to decide to go. Nope. Alright, muscles are released in there. I have to make sure bicep is released. Not completely. Which means, where is it coming from? Those are twingy there. It's gonna be, oh, I found it.
I'm a problem child.
I thought this one was good, but it's the inside right here. Let's see. I don't know if you guys can see this, but it's tightness right here. So I'm going to push right there and down towards the joint. Get that released. Remember how tight the bicep was? Okay. So let's see if this is going to help release it. See if it moves in there. Because it's this thing right here that looks extra tight. Oh, and it moved. The joint moved again. That means I got the muscle released. And I win. Okay. Wrist moved again. There. You probably heard that one. Okay, so now we check the bicep. Oh, yay! Nice squish to it. Doesn't even feel twangy anymore. Can you tell the difference?
I don't know about the bicep. Like, the other one was definitely like the palpation was like really
This
intense
one wasn't
at first, but now
as
it's
bad.
not as intense.
Yeah, this one wasn't as bad, but I can definitely tell that this muscle let go. So,
Like, that one was definitely like it.
yeah.
When you were first touching it, it was like, oh,
Mhm.
like it shouldn't hurt that much just being palpated, but.
Mhm. And then I straighten the arm and get one last joint manipulation where it counts. There. Nice and smooth. Shoulder nice and loosened up. Because the idea is releasing the tension, causing the pain. Okay. Alright, I feel good about that.